We are the Lee family. Our journey started in 2007 with our first daughter, Jocelyn. At 4 months old, she was diagnosed with spinal muscular atrophy type 1. That's where we learned about it and began our journey into it. Then she actually passed away from the disease at 4.5 years old. And our faith has been our rock and what's got us through it all. And through that, we've been blessed with 3 other boys, Trey, Nathan, and Asher. Nathan is also diagnosed with SMA type 1, but he is now 6 years old and he's doing great.
Children that inherit this disease start showing symptoms as early as the first few days of life, and over the course of time they lose muscle strength, and it includes all muscles, so it's arms, legs, but also breathing.
Otherwise mentally intact, they are bright, they are very smart, they just encrypted by their disability because they cannot move. It is a very severe disease.
But as you can see before us is the miracle, thus her middle name is Faith, being how she got here, because we would have never have done this without our faith. First name's Kira, which means woman of light. She is a light in the darkness. She was diagnosed in utero. Did that knowing our family history.
Spinraza actually is a medication. It's probably actually one of the first kinds in its own. It's not a chemical, it's not a protein, it's DNA pieces with very specific sequences. This medicine works, it's life-saving.
By a whim, I said, well, let me try you and see. Dr. Fan answered, and she had dosed another child and said that, let me see what I can do. And the following week, she actually reached out to me and said, I just came in from a meeting. I'll do it, I can do it.
You hear about it, and
Too good to be true?
at the time, there was 2 or 3 drugs that they were in clinical trials with. And obviously you don't want to put your child through, like she said, being a guinea pig. But the potential of that was too extraordinary not to at least try. And then, by the grace of God, 3 months before she was born, the FDA fast-tracked and approved Spinraza. And she was dosed at, what?
11 days.
11 days old. And amazingly, as you can see before you, and by the doctor's amazement, there are no signs, no milestones that have missed, no issues, complications, or nothing. She's absolutely perfect.
So clearly we treated her before the weakness onset, and she is a normal baby. I mean, she walked at the age of 11 months and she was running at the age of 15 months. And this was absolutely amazing, especially when you see she was sight with her brother, and you see the difference. That actually underlines the importance of newborn screening. Identify the disease earlier and treat them earlier in time.
This is unbelievable. This is the most exciting event that happened in our field in decades, if not more.
It's still every minute that she does anything. You can't put it into words.
This has been amazing. Historically, if you think about any genetic disease, we often are only able to treat the symptoms rather than correct the disease.
This absolutely changed the natural course of this disorder. If treated early, before symptoms start, most of these patients can have normal milestones, normal development. If treated later, after symptoms develop, most patients will stop having deterioration of their condition and may even gain some strength.
I mean, we're excited about the future and what this miracle medicine is going to do for the countless number of families that we may never get to meet. It's just awesome to be able to share, again, that there is a hope. Her future is just like anybody else's future. It's wide open.